Hi everyone, this is your At the Bedside Case of the Week. This is an 18-year-old female who presents with worsening peri-umbilical abdominal pain over the last 2 days. She had a positive pregnancy test 5 days ago and has had some vaginal bleeding. Vitals-wise, she's tachycardic with a pulse of 145 and relatively hypotensive with a blood pressure of 99/70. I hope you had a chance to ask yourself the pre-questions for this week because they're really, really important. On physical exam, she's got a peritoneal abdomen. So let's talk about our differential diagnosis for this patient. Tops of my differential is going to be ruptured ectopic. To support this, she's peritoneal and she's in shock. You can also consider a spontaneous abortion. This is a spectrum of disease, and patients with septic abortions can be very, very ill. Appendicitis is the most common general surgical emergency in pregnancy. An ovarian torsion is possible due to the formation of the corpus luteal cyst in pregnancy. So you're in the room with this patient. She's tachycardic. Her blood pressure is now in the mid-90s systolics. You're asking the nurse to get IV access. What's your next step? What's going to be your imaging plan? Are you going to send her for a pelvic or transvaginal ultrasound? You think that's a good idea? Probably not, considering that she's in shock. One of the points of this video is to illustrate the importance of fast at the bedside for a patient like this. So you wheel in your ultrasound, you put the probe on the right upper quadrant, and you immediately see free fluid. You get the pelvic view, you see more free fluid. In fact, this might actually be an ectopic pregnancy we're seeing there. So now you have a tachycardic pregnant patient who's in shock with a positive fast exam. What's your next step? I really, really like this algorithm I found on WikiEM. This can save your patients' lives. If you got possible ectopic, first consider, are they stable or unstable? This patient is unstable. Proceed with a fast exam, and if you see positive free fluid, immediately order O-negative crash blood, and then don't hesitate, consult GYN. You don't need to wait for your HCG quant or any other imaging, and that patient should proceed directly to the OR. That's what happened with our patient. She was found to have 2 liters of blood in her peritoneum. She did well. She was discharged hospital day 2, and during her surgery, she had one of her fallopian tubes removed. So the takeaways from this video: unstable early pregnancy patients with abdominal pain, ruptured ectopic should be at the top of the differential. And that you can use bedside fast exam early in your evaluation. If it's positive for free fluid, start O-negative crash blood, call GYN, and get that patient to the OR for definitive management. We'll see you next week.